Good afternoon, everyone. I am once again happy to be with you and to provide you with the COVID-19 update for today, April 29, 2020. Central Georgetown continues to be the epicenter with the positive cases identified coming from the following communities. In the north of Georgetown, Kitty, Sophia, Turkine, Liliendal, Cummins Lodge, Albertown, and Cumminsburg. In the south of Georgetown, Border, Lamaha Park, South Rhymeveld, and Thirst Park. Fellow Guyanese, you would note from the areas listed that the coronavirus disease is in several of the densely populated areas in our city. We need to stop and take stock of this situation. You must adhere to the guidelines provided, or we will be in a serious situation that we cannot control. I repeat, you must adhere to the guidelines provided, or we will be in a situation that we cannot control. Many of you have read the article of the Spanish flu and how Guyana suffered during that period. And certainly, we do not want a repeat of this. For today, we are reporting 3 new cases, bringing our total confirmed cases to 78. The number of persons recovered thus far has increased to 18. Congratulations. However, deaths from the COVID-19 virus remain at 8. 519 persons have been tested, of whom 441 are negative. There are 3 persons in our COVID-19 ICU, 18 in our institutional quarantine, and 52 in isolation. Now for the global report. According to WHO, there are 2,954,222 confirmed cases, with 202,597 deaths. In the region of the Americas, the number of confirmed cases is 1,179,607, with 60,211 deaths. Today, we continue the conversation with you on the impact of COVID-19 on our most vulnerable populations. I have with me Dr. Util Thomas, Director of the Mental Health Unit at the Ministry of Public Health, who will share with you tips for coping during the COVID-19 pandemic. Dr. Thomas.
Thank you, Minister Lawrence. Good day, everyone. Guyana is in the midst of the COVID-19 pandemic, and all of us are affected in some way or the other. We have been forced to adapt a new lifestyle to protect ourselves and our loved ones. Staying at home with families, wearing a mask, washing our hands regularly, finding new hobbies and routines have now become the new norm. Many of us are finding it hard to adapt. The stress associated with this period is manifesting in different ways for some of us. Lack of sleep, constant fear, anger, confusion, frustration, anxiety, depression. All these things are what we face daily. How can we cope with all the different challenges just mentioned? First and foremost, ensure that you are talking to someone you trust about your problems, your thoughts, and your feelings. Even if that person cannot solve the problem, just talking sometimes is enough. A problem shared is a problem halved. When we talk about a problem, our brain releases chemicals which ease the symptoms of stress. Vice versa, we must be ready to listen to others so that they too can have the same benefits. Listen without being judgmental or forcing persons to talk. Ensure that you know what help is available in your local community and in your country at large so that you can solve your problems and overcome challenges. Some of the help available may include the religious groups, non-governmental organizations, the healthcare facilities where health workers are found, ministries, and other government departments. Your problems are going to feel much more manageable, and you will feel much more hopeful and confident about getting through this pandemic if you are well informed of available supports. Everyone has strengths, but sometimes we become so used to them that we tend to view them as ordinary and unremarkable. Look for them. That ability to overcome, the ability to endure, the ability to see beyond the moment. Look deep inside and recognize those strengths, those skills, and those achievements that you have and use them to get through this period. In your day-to-day routine, do not fill your time with unrealistic tasks that you may not be able to accomplish. Instead, prioritize. Focus on those that can be easily completed so as to reduce the size of the to-do list. This will reduce stress and increase your sense of achievement, giving you the opportunity and the drive to focus on the larger tasks. Set aside time for yourself every day. When you neglect your personal time, everything else suffers. So find the time to look after you. Include restarting whole hobbies such as reading, cooking, sewing, playing a musical instrument, knitting, board games, art, decorating, gardening, keeping pets, listening to music, among other things. Stay connected with family, friends, workmates, and whatever clubs, organizations, or social groups you may belong to. Fulfillment of basic social needs such as love, belonging, and connectedness brings a feeling of security and contentment, which is very important in preventing depression. Exercise, sleep and eat healthy every day. These are powerful stress busters and natural antidepressants. If you're taking medications for any pre-existing conditions, remember to take them every day as prescribed by your local healthcare provider. Do not use alcohol and other substances of abuse, such as marijuana and cocaine, to deal with stressful situations. This only adds to the problems by worsening behavior and adding to issues of misuse. And it can also affect your immune system, making it easier for you to become infected with the coronavirus. Manage the time spent looking or listening to media that can be upsetting and increase your feeling of hopelessness and panic. Instead, seek information from the Ministry of Public Health and Powerways website and Facebook page, which are credible sources. Consume only enough information to keep yourself and others safe. Stay positive. Journaling twice per week about things we are grateful for has been shown to have powerful positive effects on emotional well-being. And of course, when in doubt, seek help from the mental health unit or any other healthcare worker. I hope that this information has helped to relieve some of your anxiety and has provided you with the answers to help you cope.
Thank you, Dr. Thomas. In our response to COVID-19 pandemic, we have recognized that mental health and wellness are important for persons to survive this crisis. We hope that the information shared by Dr. Thomas was reassuring. The Ministry of Public Health stands ready to provide psychosocial support for persons who are desirous of this service. Be brave, my fellow Guyanese. Make that call. Help is available. Most of all, remember to stay home. If you must venture out, wear your mask. Observe the social distancing guidelines, as well as the cough and sneeze etiquette. Stay safe. God bless until we meet again.